Health experts have said since the beginning of the COVID-19 outbreak that you don't need to wear a mask when you go out in public if you're healthy. Well, now they're asking people to reconsider that in case they only think that they're healthy. 9 Health expert Dr. Kohli helps to explain why that guidance is changing.
The reason that the White House may be asking us to put masks on everyone is for those asymptomatic people that may be expelling those droplets to minimize the expulsion of those droplets. So it's more those people that don't have symptoms or are minimally symptomatic that seem to be spreading this virus to minimize how many viral particles they're expelling, rather than really to be protecting the people that are healthy or the people that are vulnerable from getting infected with the virus. Now, it's important to keep in mind that there is a significant nationwide shortage of masks and personal protective equipment. So the masks we're talking about here are generally the homemade masks. And again, the reason to wear them is really to protect others, not as much to protect yourself. And the other caveat to wearing the masks is that they have to be worn correctly. Because if you're wearing a mask and you're touching your face more often, adjusting it, or the mask is contaminated and then you don't put it on properly or take it off properly or clean it properly, it could increase your infectious risk.
Dr. Kohli has been answering your specific questions each day, and we've put together a frequently asked questions page on 9news.com and on the 9 News app.